Good morning, everyone. My name is Catherine Bryan. I'm the Government Relations Director with the American Heart Association, and I am only one of over 30 partners and organizations that are here represented today. We call ourselves Invest in a Healthier Future. We are calling for an increase to the cigarette tax by $1.50 per pack. And we are gathered here for several specific reasons. And we do have a great slate of speakers here to give you those reasons. But first, I do want to just cover a couple of things with you. Tobacco-related illnesses are extremely expensive to treat. They're extremely harmful to people's health. And in Mississippi, tobacco remains a leading cause of disease and death. It is an addictive and deadly product. We all know this, we've heard this many times over many years, but it still remains true. One thing that we are talking about today is increasing the cigarette tax. It is a proven way to really create a healthier future, to prevent our youth from even starting to smoke. So today, Invest in a Healthier Future is advocating and asking for lawmakers to take action to really educate themselves on the benefits of an increased cigarette tax. This will not only improve the lives of Mississippians, it will also improve the economy, the health economy of our state, which we know is incredibly important. We are a leading state when it comes to the number of smokers. We rank 40th in the rate of cigarette tax. We have 68 cents per pack is taxed. The national average is $1.78 per pack. So we know that it's also been nearly 10 years since an increase in our cigarette tax. Many other states have increased their taxes, and it's time for Mississippi to do the same thing. The good news is we know how to win. We know what it takes. We have to have a significant increase to our state cigarette tax in order to have the drop in consumption that we so desperately need. And we do have big news to share with you today. The support is overwhelming, and we do have some polling results that we do want to go over. Today we have several people that you will hear from. In a moment, you will hear from Angela Ladner, who's the Executive Director of the Mississippi Psychiatric Association and the Mississippi Oncology Society, Dr. Michael Mansour, who is the President of the Mississippi State Medical Association, and then finally you'll hear from Glenn Bolger, who is a partner with Public Opinion Strategies. But our first speaker, he really represents the future of our state. He is the healthy future that we are so desperately seeking. Please welcome Khalil Jackson. He is a senior from St. Andrews and a member of the Mississippi Youth Advocacy Board. Khalil.
Thank you. Thank you to everyone. As she said, my name is Khalil Jackson. I'm a senior at St. Andrews Episcopal School. My great-great-grandfather used Prince Albert tobacco and contracted lung cancer, which led to his death. My great-grandfather smoked Winston cigarettes in his youth and now has lung issues and a dependence on Nicorette. My uncle followed in his father's footsteps and now suffers with severe weight loss and weakness, and his brother, my other uncle, now has emphysema from continued tobacco use. My grandfather and even my father followed a seeming tradition of tobacco usage at the detriment of their health. With me being from the latest generation of my family, it is now my responsibility to make a decision that will have a lasting impact on myself and others. And I'm not the only young person who is affected by the tobacco industry. People my age and younger are being hooked. Each year in Mississippi, 1,600 kids under the age of 18 become new daily smokers. My 18th birthday was yesterday. I could have begun buying tobacco products and continued the cycle of tobacco usage that persisted in my family. But I spent the day thinking about the youth who fell victim to the tobacco industry. Powerful people are putting a new generation of youth in harm by flooding the market with products that deliver nicotine in various ways and in various flavors, like Juuls, electronic cigarettes, and cigars. Years ago, I personally made the decision to make my generation the first in my family to be tobacco-free. Now, I make the decision to do everything I can to help my peers make the best decisions for themselves and their futures. I urge our lawmakers to stand up for the health of their constituents, especially youth who are particularly vulnerable to the marketing tactics used by the tobacco industry. Let's make this generation the generation free from tobacco. Thank you. Thank you again, and now please allow me to introduce our next speaker, Ms. Angela Ladner, Director of the Mississippi Psychiatric Association and the Mississippi Oncology Society.
Thank you, Khalil, for sharing your story about your family and your bravery and the smart decisions that you've made along the way. I know I'm not alone when I say that I love Mississippi and I want more people to be happy and healthy in our state. Sadly, out-of-state tobacco companies are preying on our citizens. Almost all smokers start smoking before the age of 21. Their addiction is not a choice. Young people are targeted before they can fully appreciate the consequences of becoming addicted to the nicotine in cigarettes. The tobacco industry has consistently targeted children and those who can least afford it. Tobacco company products are sickening Mississippians and leaving state taxpayers to pay the bill. People living with mental illnesses are more likely to smoke and be at greater risk for smoking health-related problems than the general population. Research has shown that people who have disorders of the brain are 2 to 4 times more likely to smoke than those who do not. Citizens with mental health conditions, depression, anxiety, ADHD, schizophrenia, for example, or substance abuse disorders make up 25% of our population, but they account for 40% of all the cigarettes smoked in the United States. Now listen to that again. 25% of our population has a mental health issue, and you consume 40% of all the cigarettes smoked in the United States. That's a very strong statistic. People with mental illnesses die about 5 years earlier than those without brain disorders, and many of these deaths are caused by smoking cigarettes. Smoking kills an estimated 5,400 Mississippians annually, and 1,400 children under 18 become new daily smokers each year. Smoking cost our state $1.23 billion in direct healthcare costs, including $319 billion in Medicaid costs every year. Additionally, Mississippi experiences $1.8 billion in productivity losses from tobacco use annually. Financially, a $1.50 increase per pack can generate $169 million in much-needed revenue annually for Mississippi, which will save us $987 million in long-term health care costs through adult and youth smoking decline. Every state that has significantly increased the cigarette tax has seen an increase in revenue despite any resulting reductions in smoking. With these facts, I am proud and confident in the Mississippi Psychiatric Association and the Mississippi Oncology Society's decision to join the chorus of voices behind me pleading for action to help more Mississippi smokers quit and be healthy. Our next speaker will dive more into what our medical providers see every day. Please give a warm welcome to Dr. Michael Mansour, President of the Mississippi State Medical Association.
Thank you so much. Good morning, I'm Michael Mansour. I'm a cardiologist in Greenville, and I'm president of the Mississippi State Medical Association. I see the deadly effects of smoking really on a daily basis. Patients who could otherwise lead healthy lives suffer with cardiovascular disease, malignancies, lung disease, because they smoke, or are just exposed to secondhand smoke is also very lethal. People who are exposed to just secondhand smoke, sitting next to someone who smokes, have a higher incidence of heart attack than people who would otherwise not be exposed to that hazard. Physicians, like me, know that the single most effective tool the state has to improve health and the quality of life is a user tax fee on cigarettes and other tobacco products. $1.50 pack state tax would force thousands of Mississippians to stop smoking and prevent thousands of others from ever starting to smoke, especially in our teens and younger population. We know that if people don't start smoking by the time they're in their early 20s, they usually will not start smoking at all. With our partners, invest in a healthier future. We urge the legislature to raise a cigarette tax by $1.50 a pack. Smoking kills many thousands of Mississippians and importantly causes many other thousands, many more thousands to be hospitalized every year. You've heard the cost of billions of dollars in direct medical costs, estimated at $1.2 billion by some accounts, and the direct cost to the Medicaid program in Mississippi from the effects of tobacco use is $320 million a year. Diseases caused by smoking are a great burden to our state budget. $1.50 per pack would save the Medicaid program millions of dollars that otherwise could be used and needed, would be used to treat smoking-related illnesses and could be used for other health care benefits. So to sum it up, we believe that just smoking stinks is a common phrase that people use. Smoking causes heart attacks, strokes, cancer, and premature death and disability. Smoking costs our state millions of dollars every year. Our public officials can stop many young people from smoking and provoke many others to kick the habit just by adding a cigarette user's fee to the current tax structure. So we ask that this be implemented now to save lives, save money. We ask that you act now, and thank you very much for your time.
Thank you, Dr. Mansour, Khalil, and Angela. I do want to introduce to you Glenn Bolger with Public Opinion Strategies as a partner with the organization, and he will discuss in more detail the polling results that we have kind of been hinting around about today. So I give you Glenn Bolger.
Thank you. Good morning, and thanks for having me in Mississippi. We completed the survey October 27th through 29th among 500 registered voters statewide. 200 of the interviews were conducted with cell phone respondents. When we asked specifically about a $1.50 increase in the tobacco tax, we found significant support for the increase. As you can see the chart over here all the way on my left, we found 73% favor and only 26% who oppose increasing the cigarette tax by $1.50 per pack. What's not remarkable, but it's very consistent. I have done work for American Heart Association and ACS-CAN in a number of states across the country, and one of the findings that's very consistent is not only is there support for tobacco tax increase, but it crosses party lines. As you can see from this chart to my right, Republican support is 71%, opposition is 29%, independent support is 69-30, opposition, and Democrats supported at an 80 to 19% level. There are very few issues today in American politics where you find only a 9-point difference between Republicans and Democrats. This is not a partisan issue. This is across party line, strong support for tobacco tax increase. And that's just not something that is unique to Mississippi. Again, having done this in a number of states across the country, you see it over and over again. And you look at the state overall by region in the state. On the map over here to my left, you can see that there's strong support throughout the state. The lowest level of support is 67%, and that's in the Delta River region. So even there, it is more than 2-to-1 in favor. Again, strong support there. You look at the coast, it's 71-29. You look at South Hills, it's 71-29. Metro Jackson, 78-20. North Hills, 77-22. And all the way up north in the TVA region of the state, 77-22. So again, strong, broad, bipartisan support. We didn't want to overdo it in terms of the charts, but I just wanted to share a couple other crosstabs with you. Ideologically, among conservatives, 69% support, only 30% opposed. Moderates, it's 77-23, and among liberals, it's 83-16. So a 14-point delta between conservatives at 69% and liberals at 83%. That's not very significant. That shows you that it crosses ideological lines as well. There is strong and broad and deep support. And then the last number that I'd like to share with you is looking at the crosstabs among both smokers and non-smokers. Not surprisingly, non-smokers supported 79-20. Okay? But we even have a majority of smokers who supported 53-46. And having done focus groups on this in other states, what smokers are telling us by a majority of them supporting this is, help me quit smoking. If you increase the price, it's going to either give me impetus to quit, or I'm certainly going to cut back as well. And so when you have a majority of smokers saying, yes, please make this product more expensive, that tells you that they recognize the impact on health. It also tells you how addictive nicotine can be. So when they are supporting that, that tells us something. So again, strong support throughout the state, across party lines, across ideological lines, and even a majority of smokers support a $1.50 increase. And with that, I would like to turn it back over to Catherine.
Thank you very much, Glenn, and to all of our speakers, and thank you for being here today. The message is clear. The people of Mississippi overwhelmingly support a tax. This is not a partisan issue. It's not a political issue. It's a human issue. The health of Mississippians should not lie amongst politics. Everyone's health is important. So with that, I thank you again for being here today. We are urging for a significant increase. $1.50 added to our per pack added to the cigarette tax will make a huge difference in the health of Mississippians. Our speakers are available for interviews if you would like to speak to them. So thank you again for being here today. Thank you for all of our advocates for being here as well.